Thank you, Mr. President. Mr. President, I come to the floor today, as I do week after week, as a physician who's practiced medicine in Wyoming for almost a quarter of a century, to give a doctor's second opinion about the health care law, a law that I believe is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients, and terrible for taxpayers. Well, on March 23rd of this year, a little over 2 weeks from now, we'll mark the second anniversary of the President's health care law being signed. 2 years ago at this time, Democrats in Congress said the Americans would learn to love this law. And as a matter of fact, March 28th of 2010, the senior senator from New York, Senator Schumer, said, quote, "As people learn what's exactly in the bill," he said that 6 months from now, by election time, that was the election to 2010, remember, he said this is going to be a plus because the parade of horribles, particularly the worry that the average middle-class person has that this is going to affect them negatively, he said those will have vanished, and he said they'll see that it'll affect them positively in many ways. Well, Mr. President, here we are 2 years later. We know that that's definitely not the case. The health care law is more unpopular today than it was when it was passed. And Nancy Pelosi famously said, first you have to pass it before you get to find out what's in it. Well, the more the American people have learned about the President's new law, the less they like it. Maybe that's why the White House and Democrats in Congress are hoping that this anniversary, this 2-year anniversary of the health care law, passes quietly and without great fanfare. Well, Republicans believe that the American people deserve to know exactly how this law is going to impact them as well as the health care they receive. So in the lead up to the second anniversary of the law, I'm going to talk about specific ways that the law has actually made it worse for the American people. Something that I believed from the beginning would happen, and now 2 years later we're seeing is specifically the case. It's hurt jobs, it's driven up costs, it's given Washington more control over Americans' health care, and I believe it's weakened Medicare. Today, Senator Cornyn and I are going to focus on how the law threatens Medicare, and specifically our seniors trying to get a doctor, or seniors trying to get health care, and how this new Washington board, called the Independent Payment Advisory Board, has had that impact. It's an unaccountable board, it's unelected, it's a group of unelected bureaucrats that will decide how to fund the care that is covered by Medicare. So I come to the floor with my colleague, Senator Cornyn, and he's been traveling around the state of Texas as I've been traveling around the state of Wyoming, talking to seniors, visiting with them, asking about their needs. And they have great concerns about what is happening with this health care law, to the point that this week the House of Representatives is actually working in a bipartisan way to repeal this board, these unelected Washington-appointed bureaucrats. To me, it's the commission that's going to ration seniors' care and make it harder for our seniors to see a health care provider and get the care that they need. And I know Senator Cornyn is leading the effort in the Senate to work with the House in an effort to repeal this payment board. So, and I know, Senator Cornyn, you're doing this in an effort to protect our seniors, to make sure our seniors get the care they need. So I would ask that you could possibly share with me and others the concerns that you have, the concerns that you've heard, and the way that you're hoping to address them.
Mr. President, I'd be happy to respond to my colleague from Wyoming, Senator Barrasso, who's been not only a United States Senator, but a medical doctor, and who has been on the receiving end of government policy that, while it may be well-intended, backfires. And particularly this bipartisan support now we've seen in the House Energy and Commerce Committee yesterday, where they voted to repeal this Independent Payment Advisory Board. Independent Payment Advisory Board, IPAB, not iPod, IPAB. The reason why this is so important, and I'd just like to ask my colleague from your long experience as a medical practitioner, the purpose of this 15-member unelected, unaccountable bureaucracy to actually set prices for health care, what happens if, to the exclusion of all other health care reform that's IPAB or the federal government generally cuts reimbursement to providers. It would seem to me that we get a phenomenon where you have the illusion of coverage, but you have no real access to health care. The experience we've had in Texas is, for example, Medicaid, and the president's health care bill puts a whole lot of people into Medicaid. Only about a third of Medicaid patients can find a doctor who'll see a new Medicaid patient in the Dallas-Fort Worth area, one of the most populous parts of our state. And I know, particularly in many rural areas, and I know Wyoming has a big rural population as well, many times it's hard for seniors to find a doctor that will see a new Medicare patient, again, because reimbursement rates are so low. And I'd just like to ask the senator from Wyoming what his experience has been in that area.
Well, my experience is exactly what you described, because I think you said the words, the illusion of coverage. And when the president talked about the health care law, so often he wasn't actually talking about care. He was using the word coverage, and he was trying to use those words interchangeably. But coverage is not care. Because someone has a card, that doesn't mean they can actually see a doctor. We see that with Medicaid now, with its low levels of reimbursement, and with seniors already having trouble getting in to see a physician. This has a significant impact when an board, an independent payment advisory board, 15 unelected bureaucrats decide they're going to decide how much to pay for a doctor's visit, how much they're going to pay a hospital for bypass surgery or for a hip replacement, which is an area of my specialty. That hospital gets to decide if they're going to continue to provide that service. That doctor gets to decide whether they're going to see that patient. So, and in rural communities, if the reimbursement is so low, and I've heard this from hospital administrators in Wyoming, if the reimbursement is so low for a procedure that is primarily, if not exclusively, done on people of Medicare age, and you can think of those things that are more likely to happen with someone over the age of 65, the hospital may ultimately decide that we cannot continue to afford to provide those services and keep the doors open to the hospital. So that seniors in a community will then be denied access to care in their own community because the hospital will no longer do or provide that service, whether it's bypass heart surgery, whether it's a total joint replacement. And that senior then has to travel greater distances to try to find some place to do that. Hospital may look at reimbursements for a procedure or different kinds of technology and say, well, the reimbursement's so low, we are not going to upgrade our X-ray equipment, our MRI machine. So again, that community would suffer. And even during the debate of the health care law, we heard many rural communities that 1 in 10 hospitals were likely to actually be so financially stressed by the health care law that they may end up having to close their doors over the next 10 years. So I'm hearing that in Wyoming, but it's because of this board that the president wants to be the ones to essentially do what's to me to be the rationing of care.
Mr. President, I'd like to ask the senator from Wyoming. It seems to me that what the intent is behind this independent payment advisory board in the president's health care law, sometimes called the Patient Protection and Affordable Care Act. I think it really needs to be named Unaffordable Care Act for reasons we can go into later. But the purpose behind it, we can all understand, and that is to try to contain health care costs and spending by the federal government because, of course, health care inflation is going up much faster than regular inflation, the Consumer Price Index. So it strikes me that, as in a lot of the policy debates we have here in Washington and Congress, we all agree that we need to do something to contain costs, but we disagree about the means to achieve that affordability that we all know we need and to contain the inflation of health care costs. And I just would like to ask my colleague, rather than have Congress outsource its responsibility in this area to an unelected, unaccountable group of 15 bureaucrats from which there is no appeal and which would have the consequence, as you say, of limiting people's access, because if all you're going to do is cut provider payments to hospitals and doctors, then fewer and fewer doctors and hospitals are going to be able to see those patients. Do you see an alternative that would perhaps help contain costs more by using transparency, patient choice, good old-fashioned American competition. I'm thinking in particular about the rare success we've had in the healthcare area containing costs in the Medicare Part D program. To me, perhaps a model even where seniors have a choice between competing healthcare plans where they get their prescription drugs, but because of the choices that they have and the natural competition that occurs, you get market forces disciplining costs, and indeed it's a very popular program, but the projected cost for Medicare Part D has come in about 40% less than what was originally projected. And it strikes me that that's one of the missing elements here with this outsourcing of this responsibility to this unelected, unaccountable group of bureaucrats, where the only thing they try to do is cut provider payments. Do you see any alternative along the line of Medicare Part D or otherwise?
Well, I think that the two key words that I heard the senator from Texas say are choice and competition, because those things put the patient at the center. It is patient-centered care, not government-centered care, not insurance company-centered care, but patient-centered care. And it's something that we've been talking about for years on the Senate floor, at least on this side of the aisle, to put the patient at the center, to give them the choice, as well as have the availability of the competition. I mean, the concern I have, and I was at a statewide meeting in Wyoming of a number of our veterans and their families, and I asked this simple question: how many of you believe, under the health care laws passed, that you're actually going to ultimately end up paying more for your health care? Every hand went up. Every hand. Over 100 people there in Casper. Over 100 hands went up. And they all believe they're going to end up paying more under the president's health care plan than they would have had it not been passed. And that's what we're seeing from a lot of the research as well. The admittance that the care costs are going up even faster under the health care law than if it hadn't been passed. And then you ask the critical question that the senator from Texas has referred to about the availability of care, the quality of care. If you ask the question, how many of you believe that the availability of your care and the quality of your care under the president's new health care law will go down? Again, every hand in the room went up. These are all people that believe that this health care law, crammed through Congress, crammed down the throats of the American public at a time when they were shouting, no, we don't want this, that they believe, the American people, that it made it worse, that they're going to end up paying more and getting less for something that they didn't ask for at all. The American public did have concerns from the beginning, which is what generated the whole discussion about health care and reform. And what patients are looking for is the care that they need from the doctor that they want at a cost they can afford. And under the president's health care law, they're losing all three.
Mr. President, I would just like to thank the senator from Wyoming for his response. I think it shows there is an alternative to this outsourcing of our responsibilities to try to make care more affordable to this group of unelected, unaccountable bureaucrats, and cutting provider payments, which actually limit access to health care. But I'd tell my colleagues from Wyoming, I had an experience a couple of years ago visiting with some folks at Whole Foods, the grocery chain that's headquartered in Austin, Texas, where I live. They vote each year, I believe. John Mackey, the CEO, is very proud of this. They vote each year on their health care plan. And what they have chosen, the employees choose year after year, is a high deductible insurance coverage for catastrophic losses, but then to cover the rest of their that actually the Whole Foods makes contributions into this health savings account, which is then owned by the worker, and can then be used to pay for their health care for the regular sort of routine needs. And I remember sitting at the table with a number of the workers and talking about why they liked this alternative so much, and it's clear because it gave them the choices that we all would want for ourselves and our families in terms of the doctor we want and the kinds of treatment we want, and it provided incentives because people were spending not the government's money, some sort of a credit card that they would never see the bill for, but they were spending their own money in their health savings account, thus realigning incentives for not only providers but also for consumers in a way that creates more transparency, more choices, and the kind of market discipline to hold down the cost. I would just ask my colleague, my impression is while there was great division in Congress over the passage of the Patient Protection and Affordable Care Act, what some people call Obamacare, 60 Democrats voted for it, 40 Republicans voted against it in the Senate, that on this issue, on the IPAB, the Independent Payment Advisory Board, there actually is bipartisan support, particularly the House Energy and Commerce Committee, to take out that particular provision because people now on further examination have seen why it could actually backfire in limiting people's access to health care. And I would just ask my colleague, do you see a way for us to, on a bipartisan basis, to narrowly address that provision while we continue to wait on the Supreme Court of the United States to rule on the constitutionality of the individual mandate? We don't know how things like the state-based insurance exchanges will operate and the subsidies and whether those are going to be affordable or not. But on the narrow issue of repealing the Independent Payment Advisory Board, do you see the possibility for bipartisan support for that?
Well, I would believe that there is going to be bipartisan support. We see bipartisan support in the House. I'd like to see bipartisan support in the Senate, because when you look fundamentally at what this board does, they make recommendations, and it's practically impossible for the recommendations not to automatically become law. And we were elected to make laws, not having independent parties make the laws. American patients are going to be forced to accept whatever this unelected board's recommendations are. Very hard for Congress to override, so I would expect in a bipartisan way people would say, let's go and completely eliminate this board, which I know your piece of legislation is designed to do. The American patients, people all across the country, if they suffer from the recommendations of the board, the way that the law is written, they can't challenge this unelected board in court. Americans have a right to challenge things, but not this unelected board as was written into the health care law. So those are the sorts of things that I hear about when people say, well, what if I can't get a doctor? What if I can't get the care I need because of the decisions made by the board? So this fundamentally gets to the issue of the whole health care law, which took $500 billion from our seniors on Medicare, not to save and strengthen Medicare, but to start a whole new government program for someone else. And this board that I think we should eliminate, this board, which I think is going to be hurtful for our seniors, is the group that is responsible for making the sorts of very challenging cuts from our seniors on Medicare, again, not to help save Medicare, but to start a program for someone else, which is why this health care law is even more unpopular today than it was the day it was passed. So I think we do have a bipartisan reason to eliminate this, and that's why I'm supporting your legislation.
I would just like to ask my colleague one final question, perhaps. Whenever we talk about reforming, saving, and securing Medicare so that we can keep our promise that we've made to seniors that when people reach the appropriate age that they can actually qualify for this benefit and it actually will be there for them. And in fact, people do in fact pay into this fund. They expect to get their money's worth back. That sometimes the charge is made that various reform proposals will destroy Medicare as we know it. But I would like to ask the senator from Wyoming, a medical doctor by profession, whether Medicare as we know it, as currently constructed under the President's health care bill, with this IPAB provision in place, does it have any chance of survival as it currently operates now with this new board of unelected, unaccountable bureaucrats setting prices and limiting access because doctors and hospitals simply can't afford to provide the service at that cost. Doesn't that have the potential to radically transform Medicare as people have come to know it?
My view is that people will still get a Medicare card in the mail, but whether there are people or hospitals, doctors and hospitals or nurse practitioners and others who will accept that card is the bigger concern. Because of what this board may do and is likely to do under the demands of the health care law, those on Medicare today and those coming on to Medicare may have a harder and harder time finding a doctor and a hospital to care for them. And let's face it, today about 10,000 baby boomers will turn 65. Yesterday, about 10,000 baby boomers turned 65. Tomorrow, about 10,000 baby boomers will turn 65. We need to make sure that Medicare is there and secure for the current generation as well as the next generation and generations to come. And my concern is that this board that I know you're trying to repeal, I'm trying to repeal, is going to make it that much harder for our seniors to receive the care that they need from a doctor that they want at a cost they can afford.
Mr. President, as we approach the 2-year anniversary of the passage of the Patient Protection and Affordable Care Act, otherwise known as Obamacare, there's a lot of things that you're going to hear from both across the street at the Supreme Court of the United States and the constitutional challenge to this individual mandate, which is a very important constitutional question for the Supreme Court to decide whether there is any limit to the power of the federal government when it comes to forcing you to buy a product approved by the government and penalizing you if you don't do it, whether that is within the constitutional power of the Congress under the Commerce Clause. And then there are other important questions about the workability of the law, the affordability of the law. But I think we can today just say this: if we can work together in a bipartisan way to repeal the IPAB requirement, and Senator Reid's the only one who can, as a majority leader, can bring it to the floor, but hopefully in light of the bipartisan support this has gotten on the House side, he will see fit to do that. I certainly would encourage him. I know Senator Barrasso would encourage him to do that, and hopefully we can do this and help ensure that people, when they qualify for Medicare, just don't get a card, but actually have a good chance, or I should say better than a good chance, they will be able to find a doctor who will treat them for the price that the government is willing to pay.
Well, thank you for the efforts on your part to repeal this, I think, terrible idea that was a fundamental part of the President's proposal, and it's one why I think the health care law is even more unpopular today than it was the day it was passed and signed into law almost 2 years ago. With that, Mr. President, I yield the floor and suggest the absence of a quorum.
The clerk will call the roll of the United States Senate.
Mr. Akaka.